In this episode of Ask the Doc, I got a really great question from someone that's dealing with a diagnosis of tendonitis of the shoulder and bursitis that's done a bunch of PT, cortisone shots, and they're still having problems. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution. And we are on a hell of a mission to make chronic injuries obsolete by helping people that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road, like pain pills, injections, and surgeries, which only make things worse. So the Ask the Doc series is one of my favorite series where people just send me messages and ask me questions about what's going on. You know, the current medical model is completely broken, full of false promises and lies, shitty treatment, poor outcomes, and things are just getting worse and worse where people have to resort to pain pills, injections, and surgeries, which really just mess things up and make things a lot worse. So my goal with these is to kind of clean up the conservative care model and help you understand what your problem is, because you can't fix a problem if you don't know what it is in the first place. So we got a great question this week. I'm going to read it. I was diagnosed with tendonitis and bursitis of my shoulder. I did 2 cortisone shots and 2 months of physical therapy. I felt better when I wasn't using it, but as soon as I got back to working out, all the pain was back. Any insights? Thank you so much for sending that question in, and sorry to hear that you're dealing with this. We hear cases and stories like this all the time where the proper diagnosis wasn't made. And as I say all the time, you can't fix a problem if you don't know what it is in the first place. Going into the idea of tendonitis, anything with itis, what you have to understand is it's just bullshit for the doctor. The practitioner has no idea what's going on. It just tells us that something is inflamed in there. Instead of like figuring out why it's inflamed, they go right to treating it. They're like not looking for the cause, they're really treating the effect. So they'll do a cortisone shot and it might make you feel better, but didn't fix the problem. What's really going on is actually a deeper problem, and it gets missed a lot. What happens in those areas, especially in the shoulder, I see this in the elbow, it's really common in the knee and in the foot as well, in the Achilles tendon. The tendon gets overworked just from the muscles getting beat up, not being able to do their job, and it actually develops what's called a tendinosis. A tendinosis is like degeneration of the tendon. So what I wanted to include in this week's Ask the Doc is an older video I made kind of breaking down the difference between tendonitis and tendinosis and really helping you get educated properly about what's going on so you can make the right decisions, do the right treatment, and not have this get a lot worse. So I'm going to drop that video in first so you can check it out. Getting our educational video out today, I want to talk about the idea in the diagnosis of tendonitis and how it's one of the most common diagnoses out there for injuries in the body, but it's actually incomplete and is actually very uncommon compared to something worse. So what we pulled up here was a Wikipedia page on tendonitis. Basically, tendonitis means inflammation of a tendon. Is a type of tendinopathy often confused with the more common tendinosis, which has similar symptoms but requires a different treatment. That's the key, the different type of treatment. That's very basic, but it means a big deal of a lot of things. So a lot of people are walking around when they have pain in their elbow, wrist, forearm, shoulder, anywhere. They get this diagnosis of what's called tendonitis. Tendonitis just means that it's inflamed. But if it's something that's chronic and been going on for a long time, a lot of those situations are actually isn't inflammation in there. There's actually something a lot worse, an actual degenerative component of the tendon. So when you look at a tendon, normal healthy one basically looks like this. It looks like spaghetti in a box before it's cooked. It's really strong and it would be really hard to snap. That's a normal healthy tendon. But over the years with wear and tear, bad mechanics, injuries, inflammation, everything on that, the tendon really gets beat up because the muscles around there aren't working correctly, and it develops what's called a tendinosis. So a tendinosis is, if we look under a microscope, a tendinosis looks like cooked spaghetti. The problem with that is that area of the tendon is very weak. It doesn't get good blood flow, it doesn't get good oxygen, and causes the pain and inflamed type of feeling that you're feeling. What's going on in the current medical model is everyone is addressing tendinosis thinking that it's a tendonitis and they want to get the inflammation down, so they inject it with cortisone. When you do that, that actually speeds up this tendinosis process, makes this tendon even more degenerated, and they're actually showing more and more if you're likely to get a tear or some type of problem, it's because you had a tendinosis first and the cortisone makes that worse. So there's a big difference in the proper type of diagnosis. So if you're walking around with a tendonitis type of diagnosis, you've done multiple injections, and you're still not any better, it might be time to figure out that you actually have something way worse, a tendinosis, and those are more likely to tear. The difference is very important, and the difference is in the details. Thanks for watching our video, and please share this with anyone that's dealing with this type of problem. Hope you got something out of that video, maybe learned something here. The key take home here is the diagnosis matters. So much of musculoskeletal care is like, hey, I do this certain type of treatment, I'm going to treat you this way, instead of just really figuring out what's going on. I say this with a car. Like, say your car's messed up and you bring it to the mechanic and they're like, just start hammering and drilling on stuff without doing any diagnostics and figuring out what's going on. That would never be acceptable for your car, but yet we accept that for our body. And getting to the root cause of what's going on is going to be key. And knowing what the problem is so you can actually fix it helps you a lot too. Because once you know what's wrong with you, you can make better decisions about what to do with your training, with your rehab, everything else like that. Get it? The medical system's just jacked up. Nobody's really getting results. We're in a pain pill epidemic problem for a reason, because people aren't getting access to quality, hands-on, soft tissue, conservative-based treatments, and then the problem never gets fixed. It gets a lot worse, and they have to resort to bigger problems down the road. Luckily, there's some really excellent soft tissue injury specialists, and they're trained in my method called the 𝘠𝑗 method. You can get access to one of them with all the information that's listed below. Get to them. They're going to be able to figure out your problem, functionally fix it, and get you on the path to recovery and keep you the hell away from the surgeon's office and off pain pills. If you like the video, give it a comment, a like, a share. If you got any specific questions you want me to cover, send us a message. We're always here to help. And I appreciate you guys watching, and I will see you on the next one. Bye.